are there any final solutions to this that would actually allow, after diagnosis, some drug or treatment that would actually protect the cerebellum from the disease? Is there any blocking agent or anything, or any research on that that's going on?
No, that's a great thought. I think many people have thought along those lines and tried to do studies along those lines. Unfortunately, so far as I know, there's not necessarily a straightforward solution. It continues to be a very challenging disease for us to manage. The one thing which we have seen clearly makes a difference is time. Earlier we diagnose these patients, the more we are able to kind of limit the associated morbidity with these diseases. People have looked into ways to potentially block entry of inflammatory cells into the brain with medications such as Tysabri. There are anecdotal cases, especially in association with cancer immunotherapy, such as immune checkpoint inhibitors, where it seems to have paid some dividends. But there are other cases with more classic paraneoplastic syndromes where it hasn't made a difference. So unfortunately, we don't have a straightforward answer at this stage, other than along the lines of what your organization is already doing, educating people so we can recognize these patients early and treat them early and aggressively, both from the cancer standpoint as well as the paraneoplastic syndrome standpoint.
So see if this captures our conversation. Be aware of neurological symptoms. If you're a patient or victim or a family member, encourage quick consultation with a doctor about those and seek that answer. Ask questions, do your own research, come to this website, call Mayo or Moffitt if you need to, and see a neurologist. Let me ask you the frequency of PNS and the effect, because I think it is still a rare disease.
It is a rare disease. So based on some of the work we've done, I would estimate there are about 18,000 patients with this disease in the entire country. So if you compare it to some of the more common conditions, such as multiple sclerosis, it's rare. But still, there are close to 18,000 individuals, so it's still around us, and we need to be aware of it, and we need to have ability to kind of diagnose these patients.
And can paraneoplastic syndromes affect all age groups?
Yes, they can. We've had patients in really young pediatric age group as well, with underlying cancers such as neuroblastomas. We've had young adults, especially men in their 20s and 30s, associated with testicular cancer. But the most common age group where we see this is in the age group where the cancers are more common, so older individuals.